Hello, this is Angi Burns, the owner and publisher of Allen City Lifestyle, and welcome to the Allen City Lifestyle podcast. On our podcast, we celebrate the positive, supportive, and inclusive contributions of local businesses, organizations, and individuals making an impact on our community. We like to celebrate all of the amazing things that are going on in Allen, Fairview, Lucas, and Parker, and share them with our listeners so that you know the best-in-class businesses, the organizations making a difference in our community, and the individuals who are making an impact on our residents here in our area. Hello and welcome to City Lifestyle with Angi Burns. I'm excited to have you guys with us today. Today we are going to be talking to Dr. Brier with Dental Care of Lucas. So thank you for joining us. Appreciate you being here today. So today we're going to talk a little bit about your practice and then some of the myths that we have heard of in the dental world. And so you can set us straight on some of those things. So tell us first off a little bit about you and where your practice is and kind of what makes you different.
Sure. So originally I'm from Missouri. When I lived in Missouri up through undergrad, and so I was interested in surgery first. I wanted to be an orthopedic surgeon or an ER surgeon.
Everybody wants to be a doctor.
That. Yeah. So I was interested in that. And then sort of randomly, I ended up working in a dental office in high school. And it was just a good opportunity to do something different. My first job was McDonald's. And so
first job was McDonald's.
It was a good first job.
It was a great first job.
As my grandfather said, it taught me to show up on time and keep busy and all of that. So it was a good first job. But
and it also teaches you to put hot fudge in the bottom of the cone before you put the ice cream in.
That is smart. I like that.
Yep.
So this dental office came along and it gave me an opportunity to do something that certainly smelled better in there, and it was a better opportunity. So then dentistry kind of showed up as an option for me. And then I ended up getting this job in undergrad working with people with developmental disabilities. And I enjoyed that. And so I ended up actually switching my major to psychology. So my bachelor's is in psychology.
Wow.
And I still thought, I don't know, it's weird how I guess
you're like, how do I fuse the two passions that I have?
And so
dentistry and psychology.
Yeah. And so after 4 years of working directly with folks with disabilities, and then having a psych degree, it just was natural to keep going in social work at that point. So I continued on for a few years before deciding I really did want to go back to school and pursue dentistry. So I ended up having 7 years of experience working with folks with disabilities. And then going back, getting the prerequisites I needed for dentistry. Still, it's a people-oriented profession, so still got to have that piece of it. But what dentistry really brings is identifying a problem. Patient comes in with a problem, I get to help identify that problem, teach them about what's going on, and then I actually get to fix it with my own hands. Yeah. And there's something very satisfying about that.
So do you find a lot with the background in psychology, a lot of people have dental anxiety. A lot of people hate going to the dentist. It's probably like one of my least favorite things to do on the planet. So do you find that your degree helps you put people at ease when they come into your office?
For sure. And the whole way we even designed the place was to help with people feeling more at ease, because the dentist is not the favorite place of most people. And in fact, it probably ranks up as among their least favorite. And so really even the design of the practice and the team that I've chosen and that I'm thankful, work with me, they really treat our patients well and really put people at ease. And we have lots of different things that we can do to help put people at ease.
So your practice is new, but you are not obviously a new dentist. So what did you learn from working in other dental practices that you were like, I'm not doing that in mine? And then vice versa, what did you see was lacking in other practices that you were like, when I have my own practice, which is now, that you wanted to incorporate?
Sure. So I was an associate for 8 years before deciding that before I actually got to open my own. And so I certainly got more efficient in what I was doing, and really got to figure out the things that I was most interested in doing and the things that I really don't enjoy as much. And so I've become much more comfortable with focusing on the things that I'm really good at.
Yeah.
And if there are certain procedures or things that are going to be better done by a specialist, then I'm not afraid to make sure my patient has the best experience
Delegate.
they can.
Give it to
Yes.
someone else.
Yeah. And so I really was able to zero in on all that and find out who I am as a dentist. So that way, by the time I'm opening my own practice and really designing it from the ground up, I was in a well-established practice for those 8 years, and I loved it there. I loved my patients and my team, but it wasn't mine. And so to really get to design it from the very beginning with all those different patient comforts in mind and all of that, it's been really rewarding.
And it really is welcoming. I've been to your practice and it's beautiful. It's inviting. It is laid out in a way that's almost like feng shui. It's like, I want to come in these doors. It's like welcoming so that you don't walk in and it's like, oh, this is a really sterile like environment. I'm at a doctor or I'm going to have a procedure done.
Right.
It's more like, oh, I'm going to go say hi to Dr. Brier and his team. And I know I haven't had the pleasure of being a patient yet, but I do know that some of our team members at City Lifestyle have been. And the one thing that they said was how patient your team was and how they educated them on everything, every step of the way. They basically said, here's what we're going to do now. And they explained it so that you were put at ease. Is that coming from you? Or is that just how your team is?
Thankfully, I have some very naturally friendly and empathetic team members, but that was not a mistake to find those folks, and I'm grateful to have them on my team. But yeah, certainly the whole, from the very beginning, designing it that way from the beginning, and that certainly includes the team members that I found.
We have more fantastic information coming your way, so stay with us because City Lifestyle with Angi Burns will be right back. At City Lifestyle, we only partner with best-in-class businesses. And a lot of times people will ask me, well, what does that mean? We do a very rigorous vetting process for anyone who is allowed to advertise in our publications. We only partner with people who are 4- and 5-star businesses and who have great reviews with Better Business Bureau, have all of their licenses and certifications up to date. We want to make sure that our readers and listeners are only being recommended businesses who are going to go above and beyond, so you know you are getting a best-in-class business. So step by step, everybody, they're able to tell you, what you're doing and how this is going to be, so that they basically preempt the procedure with the expectation of everything. And I love that. But you not only do that with the care itself, but you do that with the payment plans. You have a membership program so people know what to expect going in for the most part.
Right.
Obviously, there are things you can't predict, but tell us a little bit more about your different approach to even the billing of your practice.
Sure. So we are in network with most of the major PPOs. But I didn't want dentistry to only be for those folks that have insurance. And so dentistry is expensive. And, even on my side, what people don't see are the cost of, if you want to have great team members, if you want to have the best technology and all of that, it's all expensive. But I don't want the expense, piece of it to keep people from getting the care that they need. So the membership plans that I have are a way that folks that don't have insurance, they can become part of our plan, and then they get a couple cleanings a year, they get their exams, any x-rays that are needed throughout the year, discounts on treatment, to start to bring those costs down to insurance levels to make care more accessible to people. Again, nobody wants to come already. And so if it's also expensive and keeping people from it, the person that hurts the most from that is that individual. Putting things off only gets more expensive and bigger, more involved treatments. So the sooner we can get people in to break down those anxiety barriers and break down those financial barriers, the patient is really who
going to benefit from that. So let's talk a little bit about that, because you said, the longer you wait on something, the worse the problem's going to get, obviously. So how do you know when to go to the dentist? And so a lot of us are like, oh, my tooth hurts. I just, how do you know when it's like, no, you need to go? Or how often do you need to go?
So really, at least twice a year at the baseline is important for everyone.
And that's if you have healthy, good teeth that you're taking care of. Yeah.
And so the problem is gum disease, cavities, oral cancer. These are all things that we're looking out for when our folks come in. those start silently. You don't, by the time you're starting to feel something, you're well along the path of an issue.
Yeah.
So the earlier we can catch those things, the better it is, for everyone. And so getting those oral cancer screenings and really having someone look at the health of the gums, that's going to help keep you as healthy as possible. So, but of course, if you're having pain or discomfort, it really is in your interest to get that checked out.
Yeah.
Sometimes what will end up happening is, oh, well, I noticed maybe a bubble of infection or something, but then it got better. Then it's not hurting anymore. Unfortunately, those don't just go away on their own. They always come back bigger and eventually a bigger, more expensive problem.
It's going to be more expensive if you wait as well.
Right.
So if you're preventative and proactive, then you're probably going to end up spending less than if you just wait until it's a major issue or a problem.
Well, and then the earlier we can really come up with a plan, the more that we can really plan for it. So there are financing partners that we work with, sometimes even with little to no interest on them, where if we can come up with that comprehensive plan, you can start to plan for it financially.
Yeah.
And we can start to tackle those most important things and make our way through. And so we've really tried to find any way that we could to help break down barriers for people.
Well, I appreciate everything that you do to help anyone get help. But I also know that you have a heart for, like you were saying earlier, you worked with people with special needs and the social work aspect for a long time. So now you really try to educate everybody on their dental hygiene. And I know you work a lot with the My Possibilities Foundation and other organizations. Tell us a little bit about what you do with those organizations to make sure everyone is being served.
Sure. So as I've mentioned, it's important to me to break down barriers for people. And as I saw both when I worked directly with people with developmental disabilities, teaching those daily living skills and things like that, and then later as a case manager, finding services in the community for my clients that I served, oral health really takes a back seat a lot of times. You're dealing with just what is that individual going to do during the day when their caregiver needs to work or needs time for their own things, or medical things that come up. Just, those really pressing things often take precedence, and the oral health piece really goes to the back seat. So some of the things that my team does, we go to My Possibilities periodically.
Tell us a little bit about what
is My Possibilities?
Yes, what is it for those that don't know, who may not be as local and don't know what a wonderful organization they are.
Yeah.
Stay tuned. We will be right back with City Lifestyle with Angi Burns after these short announcements. Thank you for tuning into City Lifestyle with Angi Burns. We are committed to being involved in our community and giving back as much as we can. If you would like us to come out and throw a neighborhood block party for your community, please contact us. We bring out bounce houses, DJs, ice cream trucks, and we would love to get your feedback on our publication and introduce you to our highly qualified and vetted advertising sponsors. We do not sell anything at the events. We just come out, throw a party, and get to know our neighbors so that we know how to best serve our community. So let us know if you would like us to come out to your neighborhood. We typically serve our neighborhood for block parties during the months of May, June, July, and October for trunk or treats. So reach out to us at Angi, ANGI.Burns@citylifestyle.com to book your City Lifestyle block party today.
So they're in Plano, Texas. They really target folks as they are aging out of high school and trying to figure out what next. So traditionally, that's meant you go to high school as long as you can, and then
I think the CAP programs are typically till 22 years old,
something like that. Yeah, and so then the question is, okay, well now what? And so often folks end up going to day programs, which can provide great social opportunities and some learning experiences and things like that. What My Possibilities really does is take that next step of education, learning skills to actually try to find a job, some
Career
meaningful
readiness.
employment.
Yeah.
That's right. And so in addition to the social opportunities and things like that, it really readies folks for trying to find meaningful employment. And so it reminds me some of what I did previously as a social worker. And I'm excited to get involved more and more because I've been out of the field for some time pursuing dentistry. well, now I can really marry those two together.
Yeah.
And so, so part of what my team tries to do is to go to help educate on the importance of taking care of themselves. And obviously, everyone deserves to be healthy and to have, as few dental problems and things like that. And if we can start to take away some of the fear and anxiety of some of those folks, maybe they can, more readily get the care that they need and not be too scared off by it, and also bring it just more to the forefront for them.
Yeah, it truly does take someone special to care for somebody with any of the developmental disabilities or anything like that as a caretaker. But also, it's hard for people who have loved ones to find service providers like doctors, dentists, things of that nature that have a specialty in that type of patient, because it does take a different level of care and a different perspective to serve that the developmentally disabled or delayed. And I think that it's really great to know that they have a place with you, that if somebody has a loved one in their family that needs those services that may take more time, you will take the time, and you have the patience, and you have a training and a background and education in serving that community. And I think that's fantastic, and something that you should shout from the rooftops. Bring them to Dr. Brier if they need extra love.
Yeah. And it's so, and the other cool piece of it that we get to do too is, so we get to educate on the importance of oral health. We also get to partner and help teach about, the hipsters, as they call them, hugely important people.
Oh,
hipsters,
I love that.
Hipsters can come into our office and look at what clerical work looks like. And actually, so there's like job training as well. I can help interview people.
Very cool.
So the hipsters are used to getting interviewed by their instructors and staff there, but having a fresh, different voice that can help give them feedback and all that. So as they go out to apply for jobs. So we get to serve the hipsters in multiple ways, and including in some of that job training that they go through.
That is so special. I love that. And so tell our audience, our listeners and our viewers today, where you're located and how they can get a hold of you if they'd like to come in for a consultation or to learn more about you and your practice.
Sure. So we are located at 2695 McGarrity Lane. So that's just off of Angel Parkway in Lucas. If you look out of our waiting room, you're looking at Allen. So we're right there on the border of Lucas.
They're next to the Walmart.
So we're down from Walmart, and conveniently there's Jeremiah's Italian Ice that's on the other end of our building. So, so when you're numb, cold
and you can bribe the
good.
children. I'll get you Italian Ice if you go see Dr. Brier.
Or Smoothie King if you want the healthier option. Is also in our building as well. We see patients Tuesday through Friday. In addition to things we've already talked about, we also have a comfort menu. So whatever we can do to try to make the experience
So I was told about this comfort menu. So you're going to have to explain this to people, because I thought it was very, very unique and such a great value add to your practice. So I was told from my friend who comes and sees you that when you come in, you get a comfort menu of, do you want a warm blanket? Do you want to watch TV? Do you want to be like silent? So tell us a little bit about the comfort menu, because that is something I'd never heard of before.
So once you come in, one of the first things that's going to happen when you sit in our chair is you'll be handed an actual professionally printed menu. And so it helps to spark, if there's anything that we can do to help make your experience more comfortable for you and reduce your anxiety, we're going to do it for you. So weighted blankets. We can turn off the lights during the cleaning part to help take out some of that extra light stimulus. We play music in the office, but we can have music going in your room. There's TV. We'll literally hand you the remote and you can pick whatever you want. Headphones, stress ball, like anything you can think of that will just help kind of take you out of things and just focus on something.
Help you relax in such a stressful situation. Oh my gosh, that's genius. So love that. All right. So one more time, how do they reach you? And then website.
Sure. So the easiest way to reach us is through our website, which is dentalcareoflucas.com. Of course, you can call us too, 972-372-4568. But even through our website, you can schedule directly through the website. But of course, you can call us and schedule that way as well.
Well, I appreciate you being here today. Thank you so
Yeah.
much for sharing about your practice and your experience and what a unique experience it is to come see you. It's definitely more than just dental care. You are serving the people of our community, and I appreciate that. So thank you so much for everything that you do and what you are bringing to our Allen Fairview Lucas community. And we will see you soon.
Yeah. Thanks for having me.
Absolutely. If you are looking for the best place to market your business to our local community, please consider City Lifestyle Publications. I personally own the Allen and Plano territories, but we have over a dozen luxury publications in our area. We are a nationwide brand, so we have over 200 publications across the nation, and we really do value high editorial integrity, beautiful photography, and making sure that your story is told in a respectable and beautiful way. So if you would like to learn more about how to become an advertising partner of City Lifestyle Publications, feel free to reach out to us because we are your ticket in the door to get you face to face with your next client.